Can cancer treatment affect fertility?
Definitely, because in cancer we are using chemotherapy, radiotherapy, which can affect the gonads, and these gonads contain the very sensitive eggs and sperm. So whether it is male or the female going for cancer treatment, it could affect your fertility.
So should fertility preservation be discussed before starting cancer treatment?
100%, because fertility is one of the most important components that define women as a woman and a male as a male. So definitely that is their primary goal in life, is to reproduce. So this has to be discussed, and today with all the advancements that we have, fertility preservation is one of the primary things before going for a cancer treatment.
So now what are the fertility preservation options that are available for women?
Yeah, so for women we do have oocyte cryopreservation, which is called in simple terms as egg freezing, and that is the one of the best methods, because it is proven to be very effective too. You also have ovarian tissue cryopreservation, which is done in younger women who cannot go for an oocyte freezing. So both are performing quite well, and recently it is moved from experimental to actually it is approved for regular clinical use.
Can men also preserve their fertility?
Yes, definitely, because that is more simpler than women. Because see, women, when they go for egg freezing, it's slightly little invasive. But men, it is just about collecting a semen sample and freezing, and they can freeze multiple samples quite for longer duration also. They can freeze it for 10 years.
Is pregnancy safe after cancer treatment?
So this is something that I would tell the oncologist, has to be reviewing the patient, because after your cancer chemotherapy or radiotherapy or your surgery, whatever it may be, the oncosurgeon will evaluate you and look at, whether are you in the remission phase. There should be no, resurgence of the disease. So once they clear the patient and tell that they're fit for the fertility therapy, you can always go ahead with your pregnancy.
Last but not the least, can fertility treatment cause cancer?
Well, that's an absolute myth, I would say, because see, fertility treatments, everybody is worried about the hormonal injections that we use, but they are absolutely safe, and it doesn't matter how many stimulation cycles of IVF you go for. IVF treatment or any kind of hormonal injections during the fertility treatment will not cause cancer. In fact, I would like to tell you that if you don't have a child, you are putting you at a higher risk, to have breast cancer, endometrial cancers. So having a child gives you, in fact, protection. So taking fertility therapy to have your child is not going to give you cancer.
So as you mentioned, there are preservation options before cancer treatment. What if the patient has missed freezing oocytes or sperms? What options do they have?
Yes, this happens many times, because when a patient is going through cancer treatment, that itself is very overwhelming for them, both emotionally, physically and financially, and then comes the topic of fertility preservation. So definitely it does get missed sometimes, but I would tell patients not to worry too much about it. You come back and do take your fertility parameters. Now if things look good, you can always proceed with your own gametes, but if things are not good, like there may be azoospermia for men where there is no sperm, or completely ovarian failure, they may go for no oocyte at all for the girl, where her AMH is quite low, then there is always an option of for third party reproduction, which is called donor gamete or a donor sperm. She can still carry and have her own child. So there is always options for couples. It's just that you can come to the right fertility specialist and get the right advice.